As the Australian population continues to age and grow, so has chronic disease. This represents a significant challenge to Australia as chronic conditions are an increasing burden on the healthcare system and, more importantly, on the quality of life and overall health of everyday Australians. The National Strategic Framework for Chronic Conditions is a document that represents a coordinated effort to provide high quality guidance and policy for the prevention and management of chronic disease in Australia. This document is important to nursing and care in general, as it provides an evidence based, person centered approach on how we can help to prevent and provide care to those with chronic conditions. To understand how this document affects those living with chronic disease, I'll be discussing Barry, a 50-year-old man living with chronic obstructive pulmonary disease, or COPD. COPD involves the chronic obstruction of lung airflow that causes breathlessness, coughing, phlegm, and exhaustion with everyday activities. It usually worsens over time and can lead to a severely decreased quality of life, particularly when there are exacerbations. While COPD was a difficult diagnosis for Barry to accept, he has started to take steps to improve his quality of life, in particular, giving up smoking and joining the support group. The framework has three objectives. I have chosen Objective 2: provide efficient, effective, and appropriate care to support people with chronic conditions to optimize quality of life. For nurses, this involves providing care that is patient centered, empowering, supportive, and educational. This objective has five strategic priority areas: active engagement, continuity of care, accessible health services, information sharing, and supportive systems. Active engagement involves empowering patients to be part of the shared decision making process. For Barry, this meant providing him with the education and resources to help him engage in care and planning. Barry was then able to better manage his own care, choices, and health. Continuity of care is in regard to ensuring patients receive quality, continuous, and holistic care across all services. Barry interacts with many services and healthcare workers in the management of his condition. Fortunately, Barry's community care nurse and his GP have played a supportive role in his care and has helped Barry to liaise and coordinate continuous care with services, including pulmonary rehabilitation and support groups. Services should be available, affordable, appropriate, and acceptable. Barry has previously had trouble accessing care due to financial constraints and difficulty travelling distances and doing everyday chores due to exhaustion. However, with support from the NDIS, Barry has had more financial ability to access services and weekly home care visits, which have helped him to improve his mental and physical well-being. Barry has given his informed consent for his information to be shared between health services. This is particularly important when Barry has had to visit hospital for exacerbations, where his My Health record has given nursing and healthcare staff accurate information regarding his history and health. Barry is hopeful that supportive systems will help to identify new and innovative ways to help people with this condition live a better quality of life into the future.